Hello everyone, welcome to today's webinar. This is the last webinar in our series on changes for seniors and older adults. So thank you all so much for joining us today for the last part of this series. Our first 3 webinars are available on our website. We've been sending out the links to the recordings and the slides after each webinar, and if you're looking for previous webinars, you can find them on our website. Also, unfortunately, this webinar today is not available for continuing education credit. Previous webinars were, and so we wanted to make sure that everyone was aware of that. Getting started today, we'll have some time for questions at the end, but feel free to go ahead and type your questions into the question box as you go through the webinar. All right, and with that, we're going to go ahead and turn it over to Katie Alexander. She works at the Tennessee Justice Center, and she'll get us started today.
Awesome. Thanks so much, Carla. Hey everyone, my name is Katie Alexander. I'm the field director here at the Tennessee Justice Center, and I'm so excited to be on the webinar with everybody to go through, for the last webinar, changes for seniors, to talk about advocacy. So I've been with the Tennessee Justice Center for almost 4 years, and for the past 2 years I've been working on advocacy to change our system to work better for everybody. So I'm going to go through a couple of things that we've learned going through that process and talk about what that can look like for your organizations as well. To go over a little bit of an agenda, I'm going to talk about some updates on federal activity because for folks who have been, if you've been on all 3 webinars, I just want to make sure everybody's updated on what's happened recently, so I'll go through that really quickly. Then I'm going to turn it over to Shelby. Shelby's going to talk about protecting seniors from scams, especially in such a changing environment, because that is some information we want to make sure that everybody has. And then I'm going to go through a couple of things on the statewide level and then really spend the bulk of the time talking about different ways that we've seen advocacy work, talk about a case study on advocacy working, and then talk about what that can look like in other venues. So to get started, and again, for folks who have joined the webinars before, we've talked a lot about changes to the Affordable Care Act and the introduction of the American Health Care Act. So several weeks ago, the American Health Care Act was introduced in Congress as a replacement plan for the ACA. As many folks on the line know, the Congress has been talking about, since the election, about repealing and replacing the Affordable Care Act with something else. And so this was their introduction to the plan that they wanted to use to replace the Affordable Care Act. The American Health Care Act included, and we've done full webinars on this, so I encourage you to go back to our website if you're interested in learning more about what the American Health Care Act included. But just some highlights on it, it included $880 billion in Medicaid cuts. It meant there would be lower tax credits for people who were on the individual marketplace, and it would get rid of cost-sharing subsidies. Especially important for folks who are on this line, it changed the age rating from 3-to-1 to 5-to-1. What that means is that with the Affordable Care Act, insurance companies were only allowed to charge older folks 3 times more than what they charge younger folks. So that the same plan, you can change how much the premiums are based on how old someone is, but only on a 3-to-1 ratio. The American Health Care Act would have changed that to 5-to-1. That would have meant that here in Tennessee, for someone over the age of 55 who's not yet on Medicare but needs to be on the insurance marketplace, a low-income individual over the age of 55, and especially in rural areas of Tennessee, would have seen a premium increase of $13,750. They would have lost that much money in their tax credits, and so they would have had to pay that much more for their insurance. And that would have meant that they would not have been able to afford their health insurance coverage. So that was one piece that was in there as well. That's particularly important for folks on this line. And then there was also, part of it was that if you went for 63 days without coverage, your premium could increase by 30%. So again, that's all that I'm going to go into with this bill. The short of it is that this did not work for Americans. This did not work for Tennesseans. It was not an adequate replacement for what we have now. And on Friday, the AHCA was pulled because there weren't enough votes. So Speaker Paul Ryan said in a press conference afterwards that Obamacare is the law of the land for the foreseeable future. And so I think we should all just take a moment and recognize what that means for the people that we serve and the people that we work with. That's a huge victory. That's not to say that we can't come up with something that's better than the Affordable Care Act. We absolutely can. But this plan was not it. This plan would have been very damaging to the to people who we serve. And so we all just need to take a moment and celebrate the fact that that is not going to be what the healthcare law is moving forward. However, we do want to make sure that we are always thinking about other ways that we, other threats that are coming up. Congress has said that they will be focusing on other things that will be that they will be pushing through in Congress. So we're going to talk about that in a little bit. But before we move on, I want to hand it over to Shelby to kind of talk about, since things are changing so quickly, what that can mean in terms of making sure our seniors are protected. So Shelby, go ahead.
Hi everybody, my name is Shelby Dodson. I'm an Elder Justice AmeriCorps Fellow hosted here at the Tennessee Justice Center. It's a brand new program. Our job is to prevent abuse, neglect, and financial exploitation to people who are 60 and older. Like I said, there are 25 fellows across the country, 2 of us in Tennessee. I'm here at the Tennessee Justice Center and we service the entire state. And my colleague Matt Schwimmer is at Legal Services of West Tennessee. And he does more of a traditional legal aid for people who have experienced elder abuse. So if anybody is in that service area and runs into a problem, definitely call Matt. And if you have any issues in anywhere else in the state, feel free to call me. My contact information will be in a few slides. First, I just wanted to talk about, everyone knows that financial abuse, older adults are very susceptible to it. But particularly in times of turmoil and wholesale change, and especially with the more and more older adults are on the internet, they're on Facebook, they're seeing some sources that are right, some sources that are wrong, sometimes sources are just intentionally confusing people, and with all of that confusion and change comes opportunities to exploit seniors and really all of us, but seniors are often targets in particular because of specific factors that are specific to them, like isolation, lack of familiarity with the internet, or no training in how to vet online sources. Oftentimes they're embarrassed about needing help or figuring out what's a scam and what's legitimate. They're often reluctant to ask for help because they're afraid that if they need help, then their family will say that they can't live independently anymore, or take other action that would be that would take away the older adult's rights or just be embarrassing. Also, seniors are at risk for financial abuse because a lot of time they may be grieving at loss of a spouse. They may have been married for 50 years and never done the taxes or never dealt with the checkbook, or for whatever reason not used to managing the finances. And also, of course, just with regular aging comes cognitive impairment, sometimes Alzheimer's or dementia, and seniors can be actually affected by cognitive impairment, or they can just be worried that they would be perceived as having cognitive impairment, and that puts them at special risk for financial abuse. So we're just going to go over 3 main types of scams that can come up in this kind of environment. First is obviously the healthcare scams. So an older adult will hear on the news or on Facebook or somewhere else, Obamacare has been repealed, Medicare, or was it Medicaid, is cut. Now I know I have trouble misspeaking Medicare and Medicaid, and before I started this job, sometimes didn't really know which one was which. So you definitely can't expect older adults to be able to keep anybody to keep all this straight, especially people who are getting iffy sources. So they don't really know what's going on. So a scammer takes advantage of that, and so a scammer says, Medicare's changed. Now you have to pay for your DME or your prescriptions, or here, give me your information, I'll help you. And so what the scammer does, collects that information, insurance policy numbers, social security number, date of birth, things like that, and they can either pose as a provider and file false claims, or they can just say, pay me $200 and I'll bring you some DME, and then they never do. So they would just basically siphon cash off of the older adult directly. Another scam that can come with this type of turmoil is benefits fraud. Older adult hears food stamps are cut, Social Security is cut. Sort of the same type of model. Scammer says, I'm from Social Security, give me your information, I will help you keep your benefits, or you're eligible for a different benefit because of all the changes. But what the scammer does, they collect the information, set up an online account in the adult's name, and the older adult doesn't have any idea that there's an online account, and the scammer is able to divert those benefits to their own or to a different bank account. I'm sure you're all aware, Social Security especially can be particularly devastating for those adults who are relying on Social Security, food stamps, LIHEAP, other sources of safety net income. And then the last type of scams, immigration scams. Older adult hears, oh, you might have heard of these as grandparent scams, but we're seeing them sort of come up as scams sort of like this. Older adult hears on the news, American citizens and legal immigrants are being held at the border and are not able to come home. Scammer calls and says, this is your grandson. I'm stuck at the border and can't get home. I need you to give me money so that I can do whatever they need to do to come home. What the scammer does, of course, is cash out and drop off the map. And of course, as you might guess, immigrant families, communities of color, other vulnerable populations are particularly susceptible, especially families where being held at the border is a legitimate fear. Scammers might take advantage of that fear and say, give me the money and everything will be okay. Just real quick, some rules of thumb. If someone's being pushy, says it's an emergency, red flag. If someone asks you to keep something a secret, red flag. If you get a call from a family member in distress, don't just wire money. Call first and check with another family member. If it's your grandchild that they say is calling, make sure that you call the parent of that child, and don't send any money until you've figured out what is going on. Next, don't wire money to a stranger or put money on a prepaid card. That's a quick and easy way that scammers get money that's not easily traced. So if you hear one of those two methods, make sure that that's another red flag. Next, a great easy rule of thumb, you cannot win something that you didn't enter. Pay us $100 and we will be able to release your lottery winnings. No, that doesn't happen. And then finally, do not email financial information or other personal or identifying information. That one is pretty easy to break, so just keep it all offline. One more that I didn't include but I want to bring up is the IRS doesn't call you. Social Security doesn't usually call you. So if that happens, get off the phone, call somebody else, see what's going on. Simple things like that can really prevent identity theft and other sorts of problems. Next, just a note on tone. Avoid the bless your heart attitude or other sympathetic, anything that would make the older adult feel infantilized or otherwise childish or foolish. Next, and relatedly, avoid retaliation or frustration. If a senior reports victimization to you, we don't want them to be punished for coming forward or to feel stupid or anything like that. Instead, focus on encouraging dialogue, encouraging conversation, because if the seniors talk about scams together, then it can counter stigma and at the same time spread knowledge. Also focus on you're not alone and you're not stupid. The scammers that are siphoning money from these older adults, this is oftentimes their full-time job. They oftentimes, they or the people they're working for have spent a lot of time coming up with these stories, and they're designed to trick people. So being tricked doesn't mean that that a senior is stupid. It just means that the scammer has spent a lot of time working on their sell. And then finally, the thing to focus on is a team mentality. When I speak to seniors, this sort of looks like look out for each other, make sure you're talking about it. If it happens to somebody, make sure that we all learn from it and it doesn't happen again, so that next time the scammers will have a harder time with their cells. And finally, I just have some resources. The CFPB has a great guide on their website. It's called Money Smart for Older Adults. That's where a lot of this info came from, and it's really good. It's free to print off. They also have a bunch of materials that they send out for free. Next, AARP Foundation has an Elder Watch project. The National Council on Aging has an Economic Security project. And finally, as I mentioned earlier, if anyone has any abuse, neglect, financial exploitation cases in the state of Tennessee, you can let me know. There's my contact information right there. And if anybody has any cases in the Jackson area, West Tennessee Legal Services, you can always call them and talk to my friend Matt, who is there. And with that, I'll hand it back off to Katie.
Awesome. Thanks so much, Shelby. Let's pause for a second, since Shelby just had some really good information, just to see if there are questions on what Shelby just went over, and then we'll continue on to make sure that we're thinking about other threats that are coming up and talking about what we can do to advocate for them. So if you have questions, there is a question box that you should see in your webinar. Feel free to type in questions there, and I'll just pause for a second to give people a minute to do that. If we don't have any questions, we can go ahead and move on. And remember, too, that you can type questions at any time. Even if Shelby or I are in the middle of a sentence, feel free to type in a question so you don't forget it. Okay, looks like we don't have any questions. And Shelby will stick around, so if you do have questions, then feel free to type those in, and then Shelby will get to them. Okay, so I want to talk a little bit more. Again, I think that it's a huge celebration that the American Health Care Act was defeated. We should absolutely celebrate that. And thank you for Shelby for pointing out what we also need to be aware of for seniors with a lot of changes happening. I want to talk about a couple of other continued threats that we will be seeing, that we can see as opportunities to continue to advocate for our clients. So threats to the ACA will continue. President Trump and Speaker Ryan both made it clear on Friday that Obamacare is for now the law of the land, but Speaker Ryan has also said that he's continuing to work on something else. And so again, the ACA can absolutely be improved. It needs to be improved. There are a lot of things that need to change with the ACA, but what we saw on Friday is that it doesn't work to just take away everything and start from scratch, because we're starting with a plan that overall does good work. We just need to make it better instead of scrapping it as a whole. And we saw that on Friday. That's what the American people believe too. The American Health Care Act only had a 17% approval rating. And so I think that as we move forward, we can see opportunities to change the ACA for the better. But Speaker Ryan is working on a plan that will make changes to the ACA. Also, block grants and per capita caps are still absolutely a priority for Congress to save money. This is something that Tennessee Justice Center and others went in depth about on March 8th. So I encourage you, if you were not here for our March 8th webinar, to check that out. I'm not going to get into too much detail because for folks who were there on March 8th, I don't want to repeat things too much. But it's important to know that the battle is won in terms of the American Health Care Act, but there absolutely still will be threats to Medicaid in the future. In terms of why that matters so much for especially elder folks, Medicaid pays for 3 out of 5 nursing facility residents. And so if you're going to cut the Medicaid program, that's going to seriously hurt the nursing homes and people who need nursing homes. It will put, if we cut Medicaid programs, it will put home and community-based services at risk. So programs like Choices will be at risk once you start cutting Medicaid. Again, The original plan in the American Health Care Act was to cut $880 billion from Medicaid. We are going to guess that the next things come up will cut a similar amount of money from the Medicaid program, and that means that all of these programs are going to be at risk. So that's one that's really important for the older population. And then something else that's important is prescription drug coverage is also at risk. So right now it's optional for Medicaid to cover prescription drugs. In every single state, Medicaid does cover prescription drugs. But if you're going to have to start cutting benefits away from Medicaid because funding has been decreased so much, that's going to be one of the things that will likely be one of the first to go because it is optional. And so we all know that older Americans, that's a really huge thing if you're going to cut prescription drug coverage. So again, I'm not going to go any more in depth into that because we did talk about that on March 8th, on the March 8th webinar. I encourage you to go to our website to rewatch that, because everything pertaining to block grants is still going to be very relevant moving forward. So on the federal level, we do need to continue to fight for access to health care coverage. We need to work to repair the ACA, but we also now have some opportunities to shift focus back to the state level as well. So I want to talk for a little bit about closing the coverage gap as an avenue to advocate for people who we all serve. So part of the Affordable Care Act was that it offered the opportunity for states to expand their Medicaid program to low-income residents, and that would be at little or no cost to the state. When we were talking about after the election, when it looked like the ACA would be repealed, this is something that pretty much all states kind of said, okay, if we don't have Medicaid expansion now, we're going to pause on that because we don't know what that looks like. Now we know what that looks like. We know that that's something that's here to stay, and so that gives us the opportunity to go back and make sure that we're advocating for low-income Tennesseans to have access to health care coverage. So if we close the coverage gap, this would allow 280,000 Tennesseans access to health care coverage. And these are folks that don't have access to health care coverage now. So I want to just take a second to talk about why that is. If you see here over on the left-hand side, there are Tennesseans who have access to TennCare if they fit into a certain category. So to get access to TennCare, which is our state's Medicaid program, you have to be low income and you have to fit into one of these categories. So you have to be a child, a parent, a pregnant woman, a woman with breast and cervical cancer, and then some people with federally determined disabilities. These are also folks who need nursing home care who fit into choices criteria, which I think most folks on the webinar are familiar with the choices program. But not all low-income Tennesseans have access to TennCare. On the other side of things, you can get access to the insurance marketplace if you live above the federal poverty line. If you live below the federal poverty line, you cannot get the subsidies that help make the marketplace insurance affordable. So that's where we end up with this gap. So we have people who are living below the poverty line and they don't fit into one of the categories that would allow them to be covered by TennCare. So that's where we have 280,000 Tennesseans. The majority of them are working. There are 24,000 veterans who fit into this coverage gap who don't have access to health care coverage. And so this is a really vital thing that we make sure that these people have access to health care because 280,000 Tennesseans, these are folks who serve us. These are folks who are our waiters. These are folks who park our cars. These are folks who work in a lot of service industries. They're working hard and they don't have access to the health care that, say, our state legislators have access to. And so it's so important that now that we know that the opportunity to close the coverage gap is here to stay for the foreseeable future, we go back to advocating to close that. So there are 31 other states, in addition to Washington, D.C., who have taken steps to close their coverage gap. These are states who have taken the federal dollars to make sure that their low-income Tennesseans have access to health care. We are one of 19 who have not done so. And actually, yesterday, the legislature in Kansas voted to close their coverage gap. And there are a lot of other states that since Friday have been thinking about closing their own coverage gap. So we're really behind the 8 ball on this. All these other states are taking advantage of being able to make sure their residents have access to health care. And actually we're paying for those other states to have that because we're already paying into this system. We're already paying money to the system that would offer health care coverage to folks, but instead of that coming back to Tennessee, that's going to other states. So our legislature needs to vote yes to bring in over $1 billion per year to our state. Again, that's money that we're already putting out there. We want to be able to bring that back to our state. They need to vote yes on covering 280,000 Tennesseans. And because of the deal that we would have with the federal government would pay the vast majority of that. And something that Governor Haslam has already worked out is that the hospitals can pay for the remainder. So it would actually not cost Tennessee taxpayers anything to move forward with closing the coverage gap. And it would also stabilize our insurance marketplace and our rural hospitals. So in the past few years, 4 rural counties have lost their only hospital, and that's really devastating. In any area, it would be devastating to lose your hospital, but especially in rural areas where the next closest hospital can be an hour away. When you lose a hospital in a rural county, it's not just losing access to care, which, by the way, you're going to lose that access whether or not you have an insurance card. It's also about the job loss. It's about the economic impact of losing a hospital. And it's about the fact that when people want to move somewhere new, they look at schools and they look at healthcare. And if you don't have a hospital, it's going to be very difficult to attract new industries, attract new families. And so if we made sure that, one of the major reasons that these 4 rural counties lost their only hospital is because they saw too much uncompensated care. That's why each of the CEOs came out and said that was one of the reasons they closed down. And that's because they have such a high rate of people who don't have access to healthcare coverage. So if we were able to expand healthcare coverage to 280,000 Tennesseans without spending a dime out of our state budget, that will really help to stabilize the insurance marketplace so that people have access to care, and will help stabilize the rural hospitals. To close out on that, I just want to tell a story of someone and kind of talk about what this means, especially for older folks. So for people over the age of 65, of course, you're eligible for Medicare, so you wouldn't necessarily be in the coverage gap because you do have access to insurance. But this gives older Tennesseans a safety net. Tennesseans, especially again in rural areas who have worked manual labor their whole lives, your bodies wear out after a while. You can't keep doing that work when you're 62 years old. So this gives Tennesseans an ability to have a safety net until they get to Medicare. Sorry, I just got a comment that the sound went away. Can folks hear me? Type yes in the question box if you can hear me. Okay, it looks like it came back. Okay, great. Sorry about that if you heard a blip. So this gives older Tennesseans a safety net so that they have the ability to not wear their bodies down into the ground before they can get to Medicare. It also strengthens the Medicare program. So if you have folks who go 10 years without having health care coverage until they get to Medicare, they're going to be very, very expensive for the Medicare system because they haven't had health care for 10 years. And so if we make sure that people throughout their adult lives have access to health care coverage, it's going to strengthen ultimately our Medicare program. And I just want to tell a quick story of this gentleman who's on the screen here. His name is Bruce Parks. He's from rural Upper East Tennessee, and he's in his late 50s. He's worked manual labor his entire life. A couple years ago, he had what they call a widowmaker's heart attack, very, very severe heart attack. He was transported to a hospital in Knoxville. He was given the emergency care that he needed, but when he left the hospital with a $300,000 healthcare bill. $200,000 healthcare bill, and he left the hospital with his heart working at 15%. 15%. He tried to go back to work. His doctor said, "You cannot work. You will kill yourself if you continue to work." and so he can no longer work. He can also does not have access to a pacemaker because he doesn't have insurance, because he can't work. So he's just one of the examples, one of the hundreds and thousands of examples of people, and especially older Americans, who have worn their body down to the ground. They're not eligible yet for Medicare, but they also don't have access to anything else. And so if Bruce is able to make it to 65 years old, he'll be able to get a pacemaker, he'll be able to get the care that he needs. But if he can't, I mean, the truth is that he might not make it till then. And that is just absolutely devastating that we're putting people in that position. So closing the coverage gap is right for our economy, it's right for our people, it's right for our hospitals. And now that the Affordable Care Act is here to stay for the foreseeable future, this is again an opportunity that we can make sure people are aware of, that we can advocate for. So I know I spent a lot of time on that, but it is just something that's so vital that we are talking about. And I just want to make sure that we spent a little bit of time on it, especially since for me personally, it's something that I've been working on for 2 years. And so I can't tell you how much it warms my heart to be able to talk about it again. So to kind of wrap up that section, the opportunities for advocacy that we have now are continuing on ACA defense, making sure that we are focusing on defending the protections that the ACA has afforded for us, while also thinking about how can we improve the ACA, and also Medicaid defense. On the state level, one thing that we can focus on for the next few weeks, because the state legislative session lasts for another about 4 or 5 weeks, one thing we can focus on is closing the coverage gap, and that would make a huge difference to hundreds and thousands of Tennesseans, and especially older Americans. So what I want to spend the rest of the time doing, and then I'll make sure to leave plenty of room for questions as well, is to talk about why we advocate, and how we can all be as effective as we can while we advocate. So why should we advocate as organizations? I know many of you on the line are part of organizations or senior serving clinics, and so I kind of want to go through why it's important that we advocate. We want to make sure that we are working one-on-one with people, or because we work one-on-one with people who use these healthcare services, we know what some of the issues are that are important. I know that here at TJC, we have a very clear understanding of how the system works, not how it's supposed to work, because that's what our legislators know. Our legislators know how it's supposed to work, but we know how it actually works. And so we have a knowledge that a lot of people don't have, and it's up to us to make sure that our legislators understand that, so that we are reflecting the views of what folks that we work with are telling us. So we're really being a microphone for people who are telling us, hey, I have choices, but these are the issues that I'm seeing there. So with that, we have a very powerful voice, and especially together as a movement. So with these webinars, a series of webinars, we had about 300 people sign up for this series of webinars. It means that 300 people are learning about these issues, are sharing their information that they have on these issues, and that makes us really powerful. We have a very powerful voice, and that means we can make change happen, and we can really move forward and make sure that people are seeing what we have to say, and we can make a big difference. I got another note that there's no sound again. Can folks hear me? Okay, good. I got some yeses there. I'm so sorry if it's cutting out. Please do keep letting me know if it does cut out. Okay, so I want to talk about, with advocacy, a case study to sort of show what can advocacy look like on the ground in real life. I know that I've been to several advocacy trainings where we talk about all these higher ideals for advocacy, but we never actually talk about case studies on what it can really look like. So I want to just kind of go through what we've seen be successful with advocacy, and then talk about kind of more generally what can advocacy look like. So I'm going to go back in time a little bit. I'm going to go back a year. Some folks might have sort of been aware of what's going on. Some folks might be newer to it. But about a year ago, during this legislative session, we were pushing for Insure Tennessee, which was Governor Haslam's plan to make sure that we were closing the coverage gap. We had the opportunity to really push this plan. And so Tennessee Justice Center and the Tennessee Healthcare Campaign and 100 other organizations, we all worked very closely together to get as much done as possible. So some things that we did in the legislative session in 2016 to push for closing the coverage gap. On the first day of the session, there were 400 people who were on the Hill who were there to advocate for access to health care. We actually had people line up the hallway that all the legislators had to walk through to get to their first session. Everybody was holding signs that said things like teachers for Insure Tennessee, farmers for Insure Tennessee, mothers for Insure Tennessee, nurses for Insure Tennessee. And so every single legislator had to walk past people on both sides of the hallway holding up those signs. Throughout the legislative session, we know that Speaker Harwell got at least 300 calls from her constituents. That's from phone banking that the Tennessee Healthcare Campaign had a lead on. They did phone banking to call Speaker Harwell's constituents and say, will you call Speaker Harwell on this issue? Volunteers from across the state put up billboards. I believe there were 70 people who pitched in to pay for about 10 or 15 billboards that went up across the state that said, Speaker Harwell, we need Insure Tennessee. Martha Ingram, who is a very well-known philanthropist who lives here in Nashville, she's also a very prominent Republican donor. She makes a lot of donations to Republican candidates. She was quoted in the newspapers. She was part of the billboard campaign. She was then quoted in the newspapers saying, I don't know how they can sleep at night, referring to legislators not closing the coverage gap. And there are also actions directly outside Speaker Harwell's office. So these are kind of just a sampling of the things that happened for advocacy for closing the coverage gap in 2016 during the legislative session. The results for that is that Speaker Harwell formed a task force to come up with a conservative alternative to Insure Tennessee so that we could close the coverage gap. That also meant that Tennesseans were educated about the issue because there were so many things that got news coverage because people were writing op-eds and letters to the editor. Tennesseans learned about who's in the coverage gap and what does it mean that we are losing out on $1 billion a year to help cover those people. And the task force took some very real steps to close the coverage gap. I do want to note that we didn't stop there. Nobody stopped there. Nobody said, okay, the task force is formed, excellent, we can wipe our hands clean of it and walk away. After the task force was formed, there was so much follow-up to make sure that we were still contacting Speaker Harwell to say, we hope you're for real about this. And there were people who showed up to every task force meeting to ask questions to show we're paying attention. We're just not going to give you, a carte blanche to do whatever you want with this. We're going to have our voice heard. So that was a huge, huge success. Three-Star Health Insurance Task Force came up with the Three-Star Health Insurance Plan, which very likely could have been passed in 2017 to begin to close the coverage gap if it weren't for so much uncertainty on the federal level of what would be happening with the funds for Medicaid expansion. Some important lessons that we learned from that that I want to make sure we're sharing is you need to know who the decision maker is. So in this instance, we knew that Speaker Harwell was the Speaker of the House, and so she has the ability to really make things happen. We knew that Governor Haslam, he already supported it. He wasn't going to put a lot of effort into it. We knew that individual legislators would just kind of say, hey, I got to wait for something from Speaker Harwell. So we really chose Speaker Harwell as the person who we would focus all of our efforts on. Something else that we learned was getting creative. Volunteers came up with this idea of what if we do billboards across the state, which, all these, I heard from so many experts, quote unquote experts in grassroots organizing, that said, that doesn't work. That's not going to do anything. Billboards aren't going to, because it had Speaker Harwell's number on it, billboards aren't going to direct any calls to her. It's not worth the money. But it wasn't about getting calls to her. It was about making sure that she knew the billboards were up. So that was incredibly effective. It was very creative. It was very outside the box. You also need to make sure that they know their constituents care, so they're hearing from their constituents, and they're hearing it at every turn, that they're getting emails, they're getting phone calls, they're getting letters, they're getting stopped in the local Kroger for people saying, hey, thank you so much for the service that you do. Have you heard about closing the coverage gap? This is what it would mean for my family. So really being creative about that as well. So those are some of the lessons that we worked with so many people across the state on this issue, and actually a lot of people who were on this call, on this webinar, were part of that fight as well, and I think collectively that's what we were able to accomplish, and that's what we learned from that. So the big thing is, okay, that's great as a case study, but how do you make change happen? And I'll tell you, there is no science to this. There's no science about if you do X, Y, and Z, you will 100% get the bill that you want to see. But there are a couple of things that do make a difference. And I do want to say that probably most organizations on this line are 501c3 organizations, nonprofit organizations. We are as well. That means that you cannot advocate for an elected official. You can't say vote for this person or don't vote for this person. You can advocate for issues. You just have to make sure that there's a certain percentage of time that you can spend on it, but you absolutely can advocate for issues. And so that's something that even as a 501c3, we've put a lot of energy into doing. So what you see here is a triangle. I'm going to go over kind of this triangle of engagement or ladder of engagement to talk about the different things that you need people to do to create change and to get something to happen, and kind of some different examples of what that looks like. And again, I encourage people to type in questions in that question box, and we'll get to them at the end. So the first thing that you need to do is you need to make sure people know the information. And this is also the reason why it's a triangle, is because you need more people at the base than you do at the top. So you need to get information out to as many people as possible. That means posting things on Facebook. That means sending things out to your listserv. That means asking your staff whenever they do a training to mention whatever it is that you want to advocate for. You just want to spread the information as far and wide as possible. Once you have people who know the information, they can then inform their peers. So you have a wide base of people who know the information. You're going to get a little bit of a smaller base of people where you ask them, can you make sure that your office knows about this? So if you have an organization where you have 20 staff members and you now know the information, now you can make sure your organization knows that information. The next step from there is so now that you're informing as many people as possible, you have people who know the information, you have people who are telling their peers about it, you need to start connecting with your legislators. So the first step in there is emailing and calling them. Kind of the hierarchy for what makes a difference. Emails, they really just kind of get tallied up. They don't really get read, especially on the federal level. They get tallied up as this many people said that they want us to vote yes on this issue, this many people said they want us to vote no. The stories themselves that you might put into the email aren't necessarily heard. But when you call your legislators, they have to hear that. They have to hear your voice. And so that's something that you can do both on the state level and on the federal level, is calling your legislators and talking to their staff and making sure that they know what's going on. One step up from that that's very powerful is writing handwritten letters. So this is what we've heard kind of over and over again from staffers, is that Congress people, and again this is both state and federal, do not get a whole lot of letters. We know from Representative Jim Cooper's office, he says that he gets a handful of letters a week, maybe 2 or 3. That's what his staffers have told us in terms of how many letters they get per week. We know that on the issue of the American Health Care Act and on the issue of repealing the Affordable Care Act, our senators, Alexander and Corker, got well over 1,000 handwritten letters. And that makes a huge difference when you think about what the norm is for them. So handwritten letters, they're so vital because they do get read because it's something that's different, and they make a pretty big impression. There's also a new way that you can fax people from texting a phone number. You can fax legislators as well. That's another creative way to think about how you can reach out besides just emailing and calling. The next step that you can try to take people to is getting their peers to take action. So at the Tennessee Justice Center, we hold letter writing parties where we host a webinar every Thursday evening at 6 p.m. and we ask people to come to the webinar with their friends. So invite friends over to your home, open up a bottle of wine, watch the webinar, and then at the end of the webinar, we put out the ask for everybody to right then and there write a letter to their legislator. That's how we've gotten to get, so many handwritten letters to Senators Alexander and Corker. So the next step for people to do is to get their peers to take action. Then you really want people to be meeting with their legislators. That one-on-one connection is huge. And so on the state level, that's going to look like meeting with the legislators themselves, usually, especially for representatives. Senators, you might get passed off to a staff member. But remember that staff members are so crucial. They're the ones who have the ear of the legislators. So if you are meeting with a staff member, don't think that that's for nothing. On the federal level, almost always will be meeting with the staff members rather than with the legislators themselves. So once you get to a point where you have people taking all these actions, so you've spread the information out, you have people who know the information, and then you have people who are telling their friends about it, and then you have people who are emailing and calling and writing their legislators, and they're telling their friends to do it, and then you have people who are meeting with their legislators. And again, you don't have to have every single person who knows the information also meeting with their legislators. This is a triangle for a reason. That pool of people who are going to do that is going to get smaller and smaller as you go up, and that's okay. Then you get to this point where you have people who are so engaged, volunteers who are thinking creatively about this, and that's where you get things like the billboards. That's where you get things like the protests that happened outside Speaker Harwell's office. That's where you get people who are saying, I want to host a town hall. To show you some of this in action, what this pyramid has looked like for us, with our letter writing parties, we had people who were down on the informed peers or know the information section, a group of women who are in Chattanooga. They had been following us on Facebook, they knew the information, they would maybe sometimes share our things. And then when we put out the call that we would have letter writing parties, there was one woman in Chattanooga who had a letter writing party. She invited her peers. Her friends who went to the letter writing party then had their own letter writing parties and invited their friends. And then this web was kind of created in Signal Mountain in Chattanooga. They then met with their legislators. They then all met with each other and said, let's do a town hall, and they put on their own town hall. So if you can help people move up this ladder, then you can really make amazing things happen. So I just talked for a really long time about all that. If you can't tell, this is my favorite thing to talk about. I believe in this wholeheartedly. I've seen this work, and I think that this is something that is so vital for all of us to be thinking about how we can do this in our work. So a couple of notes to end on. Democracy doesn't end in the voting booth. I know that's corny, but it's something that I hold so dear because a lot of times what we'll see is around election time, there are lots of people who are engaged, and that's amazing, and that is so important. But it can't end there. Once we elect someone, they need to know what we want. They need to be hearing from us so they know how to vote. And our voices do matter, and our voices are powerful. And if you're on the more cynical side of things, which I've definitely woken up some mornings and been way on that cynical side, at the end of the day, our elected officials want to be reelected. Our elected officials want to keep their jobs. And they can only do that if they have the majority of people who vote for them. And so if you are telling a lot of people, if you're advocating for an issue, then it really shows that they have to vote the right way on that issue or their job is at risk. So at the end of the day, if you're feeling cynical, and you feel like your voice doesn't matter, if you feel like democracy is dead, however you're feeling that morning, do know that our elected officials want to keep their jobs, and we can make sure that we are advocating for issues in a way that they believe that they need to vote the right way in order to keep their job because the majority of their constituents want that. Again, you cannot, as a 501c3, you cannot advocate for an elected official to be elected or re-elected, but you can focus on issues. A couple ways that you can involve with TJC, learn more information about the issues that we're working on our website. Follow us on Facebook. Go to TennesseeJusticeCenter.org. Look up Tennessee Justice Center on Facebook and follow us to be able to share our information so you can start that first thing of making sure your peers understand the knowledge. And you can join our advocacy listserv by shooting any of us an email. A couple of other things, organizations, in the next couple of weeks, in the next week or two, you'll receive an email from one of us here at TJC with a sign-on letter to ask you to support making sure that we are keeping our Medicaid system whole and vital for our older population. So if you haven't done advocacy before as an organization, this is a fantastic way to take your first step. If you've been doing advocacy for 20 years, this is a great way to maybe get involved in something where it's kind of this is a whole new world for all of us. So I encourage you to be on the lookout for that and to sign on to that. And the next few days, think about what you can do to advocate for your clients. Start at the very bottom of that pyramid. Can you educate your listserv? Can you send out an email about closing the coverage gap or about whatever issue that you're following in the state legislature that you want to make sure people know about? Can you ask your board members to host a lunch and learn? Just ask a board member to host something at their office, at your office, where they're inviting people to learn about an issue. Try hosting a webinar. That's what we did, and it's such a successful thing to be able to use webinars to educate folks. So again, I know that I just kind of talked for a long time, but it is my favorite topic. Does anybody have questions either about the advocacy piece of things? We have about 8 minutes left in the webinar. Questions about the advocacy side of things or anything that Shelby went over, anything on the federal level, please do type those in. We've gotten one question on the housekeeping side of things. The question is, what should we expect not for this webinar? For this webinar, like we said at the beginning, we cannot offer CEUs for this webinar, but the question is, what should we expect? When should we expect the CEUs for the past webinars that people have attended? Kyla, can you answer that question, please?
Yeah, absolutely. I guess it depends on sort of what, are you a social worker or a navigator, or an application counselor, or a lawyer? But definitely email Emily Quinlan at equinlan@tnjustice.com if you want continuing education credit for any of the past webinars. The first 2 were offered for continuing education credit for navigators and certified application counselors, and we'll be working on sending those certificates out of what the ID number for that is very soon. And for social workers, let Emily Quinlan know, and she'll be working on those next steps. And we'll be submitting the report to the CLE and Barthing if Emily has not already done so. So it should be very soon. Just make sure to follow up with Emily Quinlan, EQUINLAN @tnjustice.org. So she will be able to answer further questions about that.
Great, thank you, Kyla. And I just typed that up on the screen, so hopefully everyone can see her email address on the screen as well. Okay, we have another question. What is the latest from the Tennessee legislature on the 3-star plan? So like I said, kind of near the middle of things, the 3-star health insurance pilot was something that was born out of the task force that Speaker Harwell put together. We have heard a couple of things from the Tennessee legislature. One thing that we heard yesterday from Governor Haslam is that he thinks it's too early to be focusing on closing the coverage gap. Which is something that we think is that it's way too late for 280,000 Tennesseans to be talking about it, not too early. So that's something that Governor Haslam just came out and said, and so if you're able to make a phone call to Governor Haslam to let him know that you think that it's not too early to be thinking about this, and that could be an important thing to do with your time. We also know that Senators Yarborough and Representative Fitzhugh They put out a bill that was supposed to go to a hearing today at noon in the legislature. We believe that bill has been rolled to come up next week because we don't expect that bill to pass necessarily, but it could be something to keep the pressure on. The likelihood that we will get Medicaid expansion in the next couple weeks is pretty slim, but it is absolutely vital that we are continuing the conversation so that our legislators don't think that this is something that's over and done and they were able to slip away for a legislative session without people talking to them about it, because this is something that it is 280,000 Tennesseans have been waiting far too long to get access to health care. We have been going for far too long without that extra $1 billion a year, and our rural hospitals are struggling, and this is a very, very real threat to rural Tennessee. And so I think it's absolutely vital that we push that message out there. And again, Speaker Harwell is our focus again, because she can make things happen in the way that nobody else can as Speaker of the House. One other quick note about Speaker Harwell for this issue and for any other issues that you were advocating for, she is planning on running for governor, and so she is one of the few people, mostly we say, you know, don't call people if you're not their constituents because they really don't care. Speaker Harwell does care for two reasons. One is she's the Speaker of the House. That means she does represent all Tennesseans in that way. And the other thing is that she will be running for governor, and so she cares what Tennesseans have to say across the entire state. So I do encourage folks to call Speaker Harwell about that issue. One other question about the CEUs. So someone asked, some of us are social workers and CACs. We do get CEUs for both. Is that correct, Kyla? The question is, if you are a social worker and a CAC, do you get CEUs for both?
I believe so.
We're going to follow up with that. So we will get back to you on that question because we're not entirely sure at this moment. We'll follow up. Okay, it looks like that's it. Again, Emily's email is on there. If you have any questions at all, especially about the CEUs, please do email Emily. You can also email her or Shelby with any questions about senior issues. And of course, reach out to me if you have any advocacy questions. And as just sort of a wrap up to the last 4 weeks, we're so grateful that folks have been here with us. For the webinar series. We're so excited that this went well. We hope that you enjoyed it. Please, please, please send us feedback because this is something that we want to keep doing, and we want to keep these relationships with all of you who have joined this conversation, because together, I mean, like I said, there were 300 people who signed up for these, and that equals some real ability to make change happen and to make sure that people across the state know about the issues that we all care about together. So I do encourage you to keep in touch with us, to email us whenever you have questions, to give us some feedback on how you feel the webinar series went, if you would want us to do another one, if you want them on different issues. Our ears are wide open to that. And thank you all for the work that you do, because I know that everyone works so hard to make things better for older Tennesseans and older Americans. So that's all we have. Thanks so much, everyone, and have a wonderful rest of your day.